What if one of the most common men's health conditions wasn't just about sex, but was actually your body's early warning system? Millions of men all around the world experience erectile dysfunction, yet so many suffer in silence. They feel embarrassed, ashamed, or they resign themselves to the belief that it's simply a normal, unavoidable part of getting older. But here's the truth. Erectile dysfunction is rarely just a bedroom issue. More often than not, it's a window into your overall health. It can be a direct reflection of your heart health, your hormone levels, the state of your blood vessels, and even your mental well-being. Today, we're pulling back the curtain on erectile dysfunction. We're going to uncover the science behind it, explore what causes it, discuss how it's treated, and explain why understanding this condition could quite literally be life-saving. So, let's start with the basics. What exactly is erectile dysfunction? The clinical definition is the persistent inability to achieve or maintain an erection that is firm enough for satisfactory sexual activity. The key word there is persistent. Occasional difficulty is completely normal. Think about it. Intense stress from work, sheer physical fatigue, having a bit too much to drink, or tension in a relationship. Everyone experiences temporary problems from time to time, and that is not what we're talking about. ED becomes a medical concern when the issue occurs repeatedly over a period of weeks or even months and starts to cause distress. And here's something many men don't realize. You are not alone. ED is extremely common. Its prevalence does increase with age, but it can affect men at almost any stage of their adult life. The numbers might surprise you. Some studies suggest that around 40% of men experience it by age 40, and that number climbs with each passing decade. The most important thing to know is that this is a medical condition, not a personal failing. To really understand what goes wrong in erectile dysfunction, we first need to appreciate what has to go right for an erection to happen in the first place. Because from a biological standpoint, an erection is one of the most impressive feats of engineering in the human body. It requires 4 different systems to work together in perfect harmony: the brain, the nerves, the blood vessels, and your hormones. It all starts with a signal. When you experience sexual stimulation, your brain sends out a message. This signal travels like electricity down your spinal cord and through a complex network of nerves to the penis. Once the message arrives, it tells the smooth muscles in the arteries of the penis to relax. This relaxation allows the arteries to widen and blood rushes in to fill 2 sponge-like chambers called the corpora cavernosa. As these chambers expand with blood, they press on the veins that would normally drain blood away, effectively trapping the blood inside. The result of this incredible hydraulic process is an erection. It's a symphony of neurochemistry and fluid dynamics. And if any single part of that system is disrupted, the brain's signal, the nerve pathways, the blood flow, or the hormonal balance, erectile dysfunction can be the result. So where does the breakdown most often occur? For the vast majority of men, the #1 physical cause of erectile dysfunction is impaired blood flow. Healthy, flexible arteries are absolutely essential for that hydraulic system to work. Any condition that damages your blood vessels or restricts blood flow throughout your body will naturally impact your ability to get an erection. This includes common health issues like high blood pressure, high cholesterol, and diabetes. Lifestyle factors play a huge role here as well. Things like smoking, which directly damages arteries, and obesity, which is linked to a host of vascular problems. This is where the idea of ED as an early warning system becomes critically important. The arteries in the penis are significantly smaller than the arteries that supply blood to your heart. Because they're smaller, they are often the first to show signs of blockage or damage from conditions like atherosclerosis, which is the hardening of the arteries. This means that erectile dysfunction can sometimes appear years before a man experiences any other symptoms of heart disease, like chest pain. It can be the canary in the coal mine for your cardiovascular health.
This is precisely why doctors take erectile dysfunction so seriously. It's not just about sexual health, it's about your heart, your arteries, and your future. But not all erectile dysfunction starts in the body. Sometimes it starts in the mind. The brain is the command center for sexual arousal, and our mental and emotional states have a powerful effect on its ability to send those crucial signals. Everyday stress, chronic anxiety, depression, and significant relationship difficulties can all interfere with the brain's ability to initiate that cascade. And this can create a particularly frustrating cycle. A man might have one bad experience, maybe due to fatigue or stress, but that one experience can plant a seed of doubt, leading to performance anxiety the next time. That anxiety then makes it even harder to get an erection, which reinforces the anxiety, creating a negative feedback loop that can be incredibly difficult to break on your own. This powerful mind-body connection is a key piece of the puzzle for many men. Hormones also have a seat at the table. Testosterone, in particular, plays a big role in influencing a man's libido or sex drive, as well as his energy levels and mood. While low testosterone isn't the primary cause in every case of ED, it can certainly be a contributing factor for some men. If a man is experiencing low libido alongside erectile difficulties, it's a good reason for a healthcare provider to recommend a simple blood test to check those hormone levels. So, how is this all sorted out? If you go to a doctor, the diagnosis usually begins with something very simple: a conversation. Your doctor will ask about your symptoms, your overall medical history, any medications you're taking, and your lifestyle. They'll also likely ask about your emotional well-being to understand the potential role of stress or anxiety. This is often followed by a basic physical exam and some routine lab tests to screen for those underlying conditions we talked about, like diabetes, heart disease, or hormone imbalances. The goal is to build a complete picture of your health to find the root cause. Now, for the most important part, the good news. Erectile dysfunction is a highly treatable condition. Treatment isn't one size fits all. It really depends on the underlying cause. For many men, the first and most effective step is making positive lifestyle improvements. Things like getting regular exercise, managing your weight, quitting smoking, and getting your blood pressure and diabetes under control can have a profound impact, not just on your erections, but on your entire body. Of course, medicine has also made incredible strides. Medications known as PDE5 inhibitors have transformed treatment for millions. You probably know them by their brand names like Viagra or Cialis. These pills work by helping to relax the smooth muscles and improve blood flow to the penis. They don't create an erection out of nowhere. They simply enhance your body's natural response to sexual stimulation. It's crucial to remember, however, that these are prescription medications. They require medical guidance and aren't safe for everyone, especially for men who take certain heart medications containing nitrates. And when lifestyle changes and oral medications aren't enough or aren't an option, there are still many other effective solutions. These can include things like vacuum erection devices, which use suction to draw blood into the penis, or injectable medications that work directly on the blood vessels. In cases where low testosterone is a clear factor, hormone treatment might be appropriate. And for the psychological side, counseling or sex therapy can be incredibly effective at breaking that cycle of anxiety. In some cases, penile implants offer a permanent and reliable solution. The single most important message here is that there are solutions. There is hope. Erectile dysfunction is not a personal failure. It is not a reflection of your masculinity, and it is absolutely not something men just have to live with. Sometimes it's a temporary issue tied to stress. Other times, it's that critical early warning sign of an underlying health condition that truly deserves your attention. But in the vast majority of cases, it can be managed and treated successfully. The first step, and often the hardest, is simply talking about it with a doctor. Because seeking help isn't a sign of weakness. It's the ultimate sign of strength. It's taking charge of your health and your life.